We still have a few people joining. But just to make sure our presenters have all the time that they deserve, I want to welcome everyone to the Center of Excellence for Infant and Early Childhood Mental Health Consultations Conference, Equity from the Start. My name is Angela Keys, and I will serve as your session facilitator. I am joined by David Crawford, who will serve as our technology host. This session is being recorded. Transcription is available through the Zoom platform. And should you have any questions, please feel free to relay them in the chat. We also want to let you know before we begin that the views, policies, and opinions expressed in this presentation are those of the authors and do not necessarily reflect those of SAMHSA or HHS. So I'm pleased to introduce this afternoon's session using qualitative data to elevate stakeholder voices in Virginia's ECMHC pilot. And happy to welcome Kayla Titus, who is with the University of Virginia, Curry School, and she will introduce the rest of her team. Take it away, Kayla.
Thank you so much, Angela. Hello, everyone. Thank you so much for joining us today. I'm Kayla Titus, and I'm an educational psychology PhD student at the University of Virginia. Presenting with me today are my colleagues, Dr. Shubhi Shatsteva, who is currently an assistant professor at San Francisco State University, but previously served as a research assistant professor at UVA, leading our qualitative research efforts. Chloe Frank, a project manager at UVA involved in the ECMHC project, and Sasha Miller-Marshall, who is a clinical and school psychology PhD student at UVA. We are delighted to present our workshop today entitled Using Qualitative Data to Elevate Stakeholder Voices in Virginia's ECMHC Pilot. I'd like to start by expressing our profound gratitude to the dedicated researchers who collected and analyzed the data we're presenting today. Their hard work and collaboration has truly been invaluable. While the majority of them are here with me today, it is important to acknowledge the team members who are not currently present, including Drs. Ann Partee and Kelsey Clayback. Additionally, we're extremely thankful to our principal investigators, Drs. Amanda Williford and Jason Downer. The Virginia ECMHC pilot is a result of a crucial partnership between the Center for Advanced Study of Teaching and Learning, or CASEL, the Child Development Resources, or CDR, and the Virginia Department of Education, VDOE. I want to emphasize that the opinions expressed in this presentation are solely those of the authors and do not necessarily reflect the views of our funding agencies. In today's session, we'll start by exploring the Virginia ECMHC pilot program and the foundational principles of qualitative research. After that, we'll delve into how qualitative research methods can enhance ECMHC by amplifying the voices of the communities it serves, using examples from the Virginia Year 2 pilot qualitative evaluation. Lastly, we'll discuss the lessons learned that can be applied to your own ECMHC work and go into further discussion about using qualitative research methods in ECMHC work. I would like to note that you can use the chat box throughout the presentation if you have questions, and we'll either have a team member respond in the chat or we can discuss your question at the end of the presentation. The ECMHC pilot project has been shaped by the recommendations of a statewide work group formed in response to House Joint Resolution 51, passed by the Virginia General Assembly in 2020. VDOE allocated federal relief funds to launch the ECMHC pilot program in early care and education classrooms, commencing in the 2021 to 2022 school year, marking our pilot year 1. To provide consultation services, VDOE enlisted 2 service providers, CDR, who is responsible for infant and toddler consultation requests, and CASEL, who is responsible for handling preschool consultation requests. Encouragingly, VDOE reallocated funding to ensure the continued implementation and evaluation of the ECMHC pilot through the 2022 and 2023 school year, which represents our pilot year 2. We also have funding through pilot year 3. Next slide, please. The pilot's objectives encompassed supporting ECE teachers in addressing children's social-emotional needs during the COVID-19 pandemic, preventing exclusionary discipline practices, and investigating the potential for extending the pilot to establish a statewide ECMHC model as documented by Partee et al. In 2023. From the outset, a mixed methods evaluation approach was employed. In pilot year 2, 191 referrals were made for ECMHC services across 152 classrooms. with 77% of the referrals seeking support for a specific child. Notably, referrals for infant-toddler classrooms tended to request classroom-wide support, while referrals for preschool classrooms typically sought support for a specific child. Consultation services were primarily delivered to programs in the greater Richmond area and Charlottesville-Albemarle areas, but programs located outside of these regions also sought and received services virtually. Services were extended to 61 programs spanning 29 different cities or counties. ECMHC services were delivered to teachers in 110 classrooms defined by their participation in teacher meetings, child or classroom observations, or the provision of family support within the classroom setting. I want to know that this figure depicts our year 2 model, which has already shifted in year 3 given the iterative process of consultation. Our model now includes programmatic consultation based on feedback received from the first 2 years of the pilot. And now I will pass it off to Shubi, who will talk more about qualitative data collection and analyses.
Hi, everyone. Thanks, Kayla. So since this was a mixed method study, we wanted to pay attention not just to the numbers that the data shows us, but also the voices that we hear from families, from teachers. And we did that using video cued focus group discussions. What video cued group discussions help us do is to center the voices of the participants. What essentially video cued focus groups mean is we have short videos that we use as a cue, and they act as a provocation for the groups, and they're able to project their ideas, their feelings, their experiences onto the video that they are watching. So the process behind choosing those videos is very deliberate, very careful, thinking about what we want to learn from the community, and at the same time, what the research questions are. So we conducted several focus groups with groups of teachers, with groups of parents, and groups of directors. And other than that, we also had several one-on-one interviews, again, with families, teachers, and also administrators. These dependent on sometimes time availability if they couldn't participate in a focus group. And sometimes it was also dependent on the sensitivity of the topic. So if a parent experienced exclusionary discipline with respect to their child, if their child was expelled, for example, from a program, and their experience was very unique to them and could be really sensitive and emotionally hard for them to talk about, in those cases, we did one-on-one interviews with those families. Other than that, we also had post-consultation surveys, which had several questions which were open form narrative, which asked, again, different stakeholders, families, administrators about their experience with the ECMHC services, so that they could tell us beyond just checking boxes how it felt to be part of the entire service that they availed. And just to add, we provided them some compensation for participating, because these are time-consuming video cued focus group discussions. They range anything from 1.5 to sometimes 2.5 hours. So keeping that in mind, we also provided them some compensation. And like I mentioned, video cued focus groups, the data that we get comes through the experience of those videos. So they are chosen very carefully and very deliberately. In this case, in case of the services that we were providing, like Kayla was mentioning, it started with a referral process, and the families or the teachers or the administrators, they gave us some description of what kind of challenges they were facing. And they ranged from things which were diagnosed disabilities in some cases to what people sometimes label as behavioral challenges in the classroom. So things like hitting, throwing things, pushing, biting. So we deliberately looked for videos that depicted those kind of scenarios in early childhood settings, because the focus was early childhood spaces in classrooms. And we had 4 videos that we used. Usually we ended up showing 3 videos. This is one of those videos. And when you watch this video, you would notice this little child who was having a difficult day that day, throwing blocks, throwing things, and the attempts that the teacher made to help him sort of move away from the behavior, sometimes successfully, sometimes unsuccessfully. And many families, many teachers had experienced similar behavior. So while they watched it, they were able to think of their own experiences consciously or unconsciously and talk about that. We can talk about that more after we watch the video. If you could maybe in the chat just quickly mention what are some things that stood out to you in this video? Some things that felt good, things that made you uncomfortable, things that you appreciated, things that you didn't appreciate. Patience of the teacher, yeah. The even tone. The teacher remained calm. Kayla, you said no, no, no. What does that mean? Maybe would have moved the child away from other kids. Yeah. The teacher is very patient. Child seems nonverbal and frustrated at times. Other things, maybe quickly. He might also have been overstimulated by other children. It was hard to watch her physically holding the child's hand. Too many children. Stating what not to do, but didn't catch what he could do as an alternative. Thank you. So what we just did is like a mini version of video cued focus groups. So when we have groups together, people watching these video clips, and usually we start with the first question, what stood out to you in this video? And the kind of responses that we are hearing from you is very similar to the kind of responses we heard from different stakeholders that we did focus groups with. And as you can see, each one of you kind of went into your own understanding, your own experience, your own thinking about children, your own training with children to respond to all of these things. And that's how video cued focus groups help us to sort of get deeper below just the surface level of data. And we did this, we chose this as a method for qualitative research in this particular pilot and study, because we wanted to get into the narratives, the voices, because COVID pandemic has been really hard on families and on teachers. And we wanted to get into the nitty-gritties of what's really going on and what do we really need to do to support teachers and to support families. And as we do that, it's also important to remember that research is a very unbalanced relationship where the researcher holds a lot of power and the participants hold very little amount of power. That happens even more when the research is quantitative, when we reduce human beings and their experiences to numbers. So introducing qualitative research method into this data collection, and also at the same time paying attention to the voices through the methodology that we chose, helped us to think about equity in data collection as well, because we wanted to center the subjective experience experiences of these participants, and each one of us experiences realities based on our own intersectional identities. And we can only hear that and understand that when we actually talk to people. And then thinking about the process, as you saw, when I asked you these questions and the responses that came up, they led to more questions. They led to questions that followed up, which helped us to understand where are those struggles coming from? Where are those challenges coming from? So when we think about qualitative research and equity in that respect, it's also important to remember that when it's more conversational, when it is personalized and individualized, we understand the complexity of the experience that that individual is going through in a more nuanced sort of a way. And the third thing that we all approached this research with, and when I say we, I mean the people that you see on your screens and people that you don't see on your screens right now, was to think about it in a way that we are not the experts and we are learning from our participants. They are the experts in their lives, and they are the ones who are teaching us about their lives. And that's the approach we took when we entered any focus group space or any interview space. And the understanding on which we built our research design for this particular pilot was sort of questioning these Western paradigms which are situated in the global north, the knowledges that are coming from the global north, and completely erase the wisdom that comes from what is considered the global south. So sort of thinking beyond the positivistic sort of understanding of research, where there is one truth, there is one real science, and what is considered trustworthy data, and going beyond that and thinking about how knowledge is created relationally, how we have to build trust to really learn about people's lives. And that's why this methodology sort of was focused in and grounded in decolonial practices, where we started with questioning the power. We started questioning how much power we hold, how we want to represent the voices that we were hearing, how do we center those voices, how do we make sure that their experiences are told to the world in ways that truly helps the communities and not just furthers our agendas as we think about it. And we did that, like I said, through a very relational, co-creative, creating knowledge together sort of a approach that we took together.
Thank you, Shubi. That was great. Next, we're going to discuss the results of our qualitative research methods. Overall, a total of 84 stakeholders participated across 3 of the qualitative data collection methods that Shubi was mentioning a little bit earlier. Total participation by stakeholder is displayed on the pie chart on the left. Note that this chart includes focus group and interview participants only. I'll explain why this is in a minute. Within the focus group and one-on-one interview formats, we heard from a total of 17 families and 16 teachers, as well as 4 program directors. Video cued focus groups were conducted with a total of 25 stakeholders, while one-on-one interviews were conducted with a total of 12 stakeholders. Please see the participating stakeholder population column in the left on the table, in the table on the right, so that you can see the number of participants in each of these data collection methods. Personal narratives were also collected from the open response field on the post-consultation survey that were sent to stakeholders via email. 47 stakeholders, some of which also participated in an interview or focus group, shared their feedback on the ECMHC pilot. Due to the overlap between qualitative data collection methods, the open response narrative population was not included in the total number of participants pie chart on the left. The post-consultation survey, where we collected these narratives, was individualized based on the stakeholder. So teachers were sent the teacher survey, families were sent the family survey, program directors were sent the director survey. Next, we'll take a look into some of the demographic information of these participants, as well as some specifics that went into planning and conducting qualitative data collection by method. Racial background demographic information was collected via self-reported pre-consultation surveys. Response options included multi-select, multiple choice, other, or choose not to specify answer choices. Qualitative interviews with teachers were made up of a variety of racial backgrounds. White teachers made up nearly 44%, while Black teachers made up nearly 38% of the total teacher population. One teacher was Middle Eastern or North African, one teacher self-identified as Brazilian, and one teacher was mixed race. Qualitative interviews with families were made up of a vast majority of mothers. 41% of moms were white and 41% of moms were Black. One mom was Hispanic or Latino, and we did speak with two dads, one of which was white and the other was Hispanic or Latino. As a side note, 2 interviews were conducted in Spanish and then translated to English for further evaluation. A total of 75% of the program director population we spoke with were white and 25% were non-white. Overall, we held 4 teacher focus groups, 2 family focus groups, and 1 program director focus group. Groups were separated according to their personal stakeholder role in order to promote a supportive community where stakeholders could connect with their peers, relate to shared experiences, and offer advice, encouragement, and/or feedback to their colleagues in similar roles. 1 or 2 ECMHC team members that you see on our screen facilitated each of the total focus groups, which was 7. Facilitators prompted participant reflection by asking these open-ended questions about the video, similar to the one that you just watched. The purpose was to probe stakeholders to share their individual and group ideologies regarding children's mental health well-being, behavioral expectations in the classroom, and the role teachers are expected to assume in the classroom. We also wanted to be sure that we acknowledge some stakeholders may not feel super comfortable sharing or participating in a large group setting for a variety of different reasons. To these stakeholders, we offered a total of 12 one-on-one interviews as an alternative to participating in a focus group. We did this to offer and ensure confidentiality and security for the stakeholders so that they could share their experiences. We spoke with 3 teachers who discontinued services before completing consultation, a total of 9 families who either opted for a one-on-one interview over a focus group, or they chose, or their child experienced exclusionary discipline practices at their program. We asked teachers in one-on-one interviews why they decided to discontinue services when they were once engaged and committed to participating in ECMHC. Alternatively, we also asked families whose child experienced exclusionary discipline how these outcomes affected the family, the resources they had at their disposal to support them through this transition, and what more could have been done to prevent this outcome. Our qualitative findings are organized around 6 overarching themes. Realizing that should be a 5, my apologies. Overall, participants across stakeholder role discuss the benefits of ECMHC services, the school-based challenges, as well as the larger systemic challenges that are faced by both teachers and families, the exclusionary discipline practices experienced by children, as well as suggestions on how to improve ECMHC services across Virginia in the future. At this time, I would like to read a quote from a program director who participated in qualitative data collection that touches on several of these overarching themes. The quote reads, "With delays and limited resources from the pediatrician and local school division, we were struggling to serve the needs of one of our students. The ECMHC program helped bridge the gap and connect our teachers and this child's parents to resources and advice that help the child have more success in school. Please keep these themes in mind as we take a deeper dive into several personal testimonies from participants that help to explain the systematic challenges faced by teachers and families.
Thank you. We mentioned a bit about the different themes. We're mainly going to focus in the next few slides on the systematic challenges that were faced, as well as the challenges faced by families and teachers. One of the themes that we found in particular was around parenting in the pandemic world, as well as the post-pandemic world. Teachers and program directors often complain about their families' parenting skills with comparisons of parenting practices from past generations to current generation. Participants expressed that current parents of their students often had soft parenting styles and were not disciplining enough, often relying on technology to support behavior management. From a parent's perspective, parents expressed that they were trying to be mindful about their parenting by thinking about their own traumas that they experienced and the traumas of their families, and the traumas that their families held, making sure that they weren't passing these traumas onto their children. While trying to protect their children from generational trauma, they also struggled to find support and resources to navigate the novelty that arose in parenting during the pandemic. While there isn't a perfect blueprint for parenting, as we all know, the pandemic made this journey challenging for parents and difficult for programs as they were viewing new behaviors by children. And these perspectives can cause a potential lack of trust between families and teachers and can be detrimental to children. Next, we'll take a look at theme around racialized discrimination and systemic oppression. As we expressed earlier, 70% of our referrals were for children of color, aligning with the research that states that children of color are often overrepresented in behavioral referrals. Families often express feeling judged for their parenting styles. While they considered the racial system their children have to grow up in their child-rearing decisions, they felt that others judged their parenting practices. Often, parenting decisions were protective factors for their children's continued growth and success, but they didn't feel like that was always how they were perceived. Black families expressed feeling a lack of understanding for the challenges that they faced in their daily lives due to their race and how these challenges influenced how they raised their children. In thinking about the worries about labeling and discrimination, these fears of judgment that we spoke of in regards to racial discrimination and systemic oppression also translated to children, as parents feared that evaluation and referrals would label their children and further widen the gap between their children and their peers. We learned from teachers and parents that parents worried about the stigmas that labels carried and feared that their children would be treated differently. These perspectives widened beyond race and included military families as well, who worried about the impact of their child receiving a label and how that would impact the family's career in terms of the parents. But they also worried about the stigmas aligned with certain labels and how that would later impact their children's future options. While these worries were valid for parents to have, it's often created a challenge for programs when considering the best way to support children while also respecting the wishes of the family. One of the things that we noticed was themes around the drug epidemic in the United States and its effects on children. We saw some of these themes come up sparingly in our earlier pilot of the program, but during the second year, it seems like this was just like highlighted in terms of getting responses from both teachers and families alike, as well as program directors. Focus groups also exposed this larger systemic issues that were impacting families. There were multiple instances where families and teachers informed us that children in question had experienced challenges related to drug addiction in direct or indirect ways. These children often showed multiple severe challenges from birth, which required teachers to have knowledge of what particular resources they could provide. The drug epidemic impacted families in many ways as well, including forcing new family structures, such as having grandparents who may have been caregivers, or other extended family members. It highlighted inconsistent presence and unstable home environments. Anecdotes in particular from teachers and program directors showed us that behavioral challenges could also be trauma responses, and therefore there is a need to understand and respond to these trauma in responsive ways. And thinking about challenges in accessing resources and absence of resources, Chloe shared a quote from a program director in regards to access to resources, but I think that also extended to our teachers and families. As we heard about the many challenges from families and program directors and teachers, participants also highlighted the struggle of accessing resources. Qualitative data shows that parents often find it extremely difficult to access the resources that they and their child need in order to thrive. Families and teachers reported that there were painfully long wait times for children to get appointments to see specialists, to get the correct diagnoses. Further, even when they did get a diagnosis, many families were unaware of the next step or the way forward. Often schools became the only source of information for families that were struggling, further adding to that burden that teachers were already carrying. We also learned that often when even teachers did not have enough resources themselves and found it hard to support families as they struggled with finding the right services for their children. Despite socioeconomic status, the perspectives on the lack of resources and support available for families of young children remains consistent across the board.
Thank you, Sasha. Now I will briefly highlight some key takeaways we've gleaned from our pilot program. First and foremost, it's helpful to collect demographic information from all stakeholders involved. This practice provides us with a comprehensive understanding of the program's context and its participants. Furthermore, by incorporating insights from both quantitative and qualitative feedback, we've successfully introduced the concept of programmatic consultation. This integration has greatly enriched our approach and also comes from recommendations from the COE and other experts in ECMHC. However, one valuable lesson we've learned is that encouraging participation in focus groups can be quite challenging. Individuals often experience initial hesitation or discomfort when faced with an invitation to participate. Overcoming this hurdle is crucial, and we found that building and nurturing relationships are pivotal. This in turn creates a safe and open environment for constructive discussions. The facilitators of these discussions play a pivotal role in this community building process at the outset of the group. They create a secure space, fostering trust among participants, especially when dealing with sensitive topics. Their expertise is instrumental in ensuring the success of our focus groups. So now we'll head into our workshop activities. So quantitative data only tells half the story. When asking research questions, quantitative data can tell you the what, but we need qualitative insights to fill in the gaps about why. Qualitative data can provide rich and nuanced insights into complex phenomena that quantitative data may not be able to capture. However, using qualitative data as evidence in scientific writing also poses some challenges and limitations that the researcher should be aware of and address in their research design, analysis, and reporting. Now that everyone has heard a little bit about how we conducted a qualitative research study and used it to inform adjustments to Virginia's ECMHC pilot, let's discuss it as a group. Based on the background knowledge you now have on qualitative research methodologies, what do you think are some challenges that researchers face with qualitative data? Feel free to unmute yourself at this time or throw your thoughts in the chat box. We'll allow about 10 minutes for reflection discussion before closing out. Maggie says funding stakeholders may not be as receptive to this data as opposed to quantitative data. Yes, that's definitely something that can be a challenge.
Maggie, I don't mean to throw you on the spot, but I wonder if you could say a little bit more in terms of what funding stakeholders, like why they might not be receptive to this type of data, as opposed to quantitative data.
Sure. I think sometimes numbers tell a story that people who provide the funding want to hear, and they feel like it gives them, that it's more factual than someone's experience, or that what qualitative data might provide, telling the story. I think it's a delicate balance I mean, I'm not a researcher myself. I deal with data a lot in my own program, but finding a way to tell the story in both and, helping have voices heard, but still meeting the needs or what stakeholders identify as their needs.
Mhm.
But as a program director, it definitely finds challenges, especially in sharing the consultant story as to how they do the work or the impact that they feel. So trying to find that balance. But I think now I'm maybe going off a little bit of the question.
No. That's a great point. It makes me like if I were to make a comparison in terms of like the education system, and we think about just like the numbers in terms of assessment that students are doing and how that doesn't necessarily represent the whole child, is the same that we think about like the quantitative data that doesn't represent the participants that we're getting that information from. So having the qualitative piece gives us an opportunity to kind of fill in those gaps and provide a bigger or a more holistic picture of the participants that we're working with, their families, teachers, program directors, but also the researchers that are doing this work. Thanks for sharing, Maggie.
Sure. And I think just thing to piggyback on that, when I hear you tell the whole picture, it's also helping stakeholders to understand why do they want to understand the whole picture? How can we use research, which I think qualitative is so important to do that.
Yeah, precisely.
Like we have another comment in the chat. Kaya Swan says, qualitative data allows the stories in the field to be elevated. Quantitative data tends to lend to impact stories, which is often the bottom line that funders want to know, which is definitely, yeah, that is so true. Yes, and both is most powerful. That's why we chose mixed methods. We definitely liked having the survey items with open-ended as well, so that we can ask quantitative items, but ask them to explain more. So that's something we didn't touch on as much here, but we don't really know why some people push certain responses in close-ended responses, so that it's good to know what they were thinking when they made that selection. Yeah, and I want to elevate what Khadija just put in the chat, that white Western paradigms still prevail in research and funding, and belief in a single simplified reality is still what dominates that. And that's very true.
One thing I did want to be sure to mention, just kind of while we're brainstorming and collaboratively like discussing all of this work, is that I found it really interesting that when we were conducting these interviews and we were wrapping up, how just sheerly appreciative all of the participants were. And we always ended out all of our interviews or focus groups by asking like if we have any additional follow-up questions once we're looking at these transcripts a little bit in more depth. Would you be comfortable if we reach back out to you? And I don't recall a single participant saying no. And so it was kind of like once we got our foot in the door, they were really, really engaged in participating and also sharing their experiences. It felt kind of like they understood the value that they had. And I feel like they were able to walk away with that value as well, which I thought was interesting.
If we switch to the next slide, we have a little bit of answers, what we're thinking here that we can help prompt the conversation with.
Yeah, so there are a couple of challenges and limitations that usually arise. This list is not extensive. Like there are things that can be added, but these are the areas that we felt might be important to kind of discuss with you today. And in thinking about like validity and reliability, we know that validity refers to how well your data and methods reflect the reality and meaning of the phenomenon you're studying, while the reliability refers to how consistent and replicable your data and methods are. In thinking about qualitative data can be affected by various factors that may compromise its validity and reliability, such as researcher bias, subjective interpretation, contextual variability, or lack of generalizability, which might be one of the reasons why like funders want to focus more so on the quantitative data portion, because it kind of more so easily addresses those challenges. But one of the tips that we would like to highlight today is in thinking about ways to improve validity and reliability, we want to think about appropriate sampling, think about what type of data we're collecting and how that data is collected, as well as what is the data analysis techniques that's being used, making sure that even though as facilitators that are facilitating focus groups, there can be room for bias there, but also when you start coding, there's also opportunities for bias in that space around data analyses. And then making sure to provide a clear and transparent documentation of your research process, as we kind of outlined earlier in this presentation, can also enhance the validity and the reliability of qualitative data.
Speaking a little bit more to some of the ethical issues that may come up when conducting qualitative research. Qualitative data often involves direct or indirect interaction with people who may share their opinions, experiences, emotions, what have you, and their identities with you as the researcher. This means that you have the sole responsibility to protect their confidentiality, their anonymity, make sure that they have that you have consent to speak with them about their topics of choice, and making sure that they have privacy and maintain their dignity. Our main goal is to avoid any harm or distress that may result from our research. So in regards to these ethical issues, we do want to offer a few tips if you ever decided to conduct qualitative research yourself. And in order to address these issues, you need to make sure to follow all ethical guidelines and standards that your discipline and institution employs. Be sure to obtain your informed consent forms from participants. Use pseudonyms or codes to conceal their identities when writing or publishing any research articles or papers. And always be sure to respect their rights to withdraw or access their data at any time.
I would like to add that participants love giving you a fake name to use for them. So it's always a great like wrap up at the end of a focus group. In terms of data management challenges, managing large amounts of data that you may generate or collect from various sources and formats can be a challenge. Some tips around that is just having a systematic and organized way of storing, organizing, labeling, and retrieving your data, as well as ensuring its quality, the accuracy of the data, and making sure that it's complete. These things can help to avoid the pitfalls with data management. You also want to use appropriate tools and software. In our case, we utilized Excel. There has been others that may have used Deduce. Also want to consider what databases you're using, spreadsheets, as I mentioned before, or qualitative data analysis software. And you also want to develop a data management plan that specifies how you will collect, store, and back up this data, as well as archive and in the future share your data. Having that plan ahead of time is helpful in being able to kind of think through what might be some challenges or problems that arise, and then being able to avoid them as you're doing the working with data. Sorry if you hear my background.
Finally, when we are evaluating data, you do want to be sure that the data considers and we consider its strengths and its weaknesses, the implications and limitations of this research, and the contributions and gaps that we may suspect. In order to elevate your data in a rigorous and honest way, you need to use appropriate methods and measures such as peer review, member checking, audit trial, and reflexivity statement, as well as demonstrating how you have addressed the potential issues and challenges of your data. You also need to be sure to discuss how your data adds to the existing knowledge or practice in your field and identify the areas and questions for further research.
Well, that concludes our presentation. Thank you so much for everyone who stuck here to the end. I'm putting in the chat these links to both the paper that we had published for the pilot year 1, as well as the ECMHC program website in case you want to learn more, and our emails are there as well. We're always happy to talk about this stuff with anyone who has further questions.
Thank you all. This was wonderful. So informative, so thoughtful, and really did get everyone thinking about how do we conduct good equity-focused data. So thank you, and thank you all for joining.
Thank you, everyone.
Thank
Have a
you.
wonderful afternoon, evening.